Welcome to the 2020 Community Forum presentation on Metformin. Is it a potential future treatment for cerebral palsy with Dr. Darcy Fehlings and Dr. Donald Mabbot? Welcome. I'm so excited to have you both here. Dr. Fehlings is the head of the Division of Developmental Pediatrics and is a professor in the Department of Pediatrics at the University of Toronto. She is the inaugural holder of the Bloorview Children's Hospital Foundation Chair in Developmental Pediatrics. Dr. Fehlings is a senior clinician scientist in the Bloorview Research Institute. Her research focuses on the innovation and evaluation of interventions for children with cerebral palsy. She is the lead investigator of an Ontario Brain Institute integrated neuroscience network focused on children with cerebral palsy, CPNet, and leads the CP Discovery Project in the Canadian NeuroDevNet networks of Centers of Excellence. She is the past president of the American Academy for Cerebral Palsy and Developmental Medicine. Welcome, Darcy. And then we also have Dr. Donald Mabbot. Dr. Mabbot received his PhD in developmental psychology at the University of Alberta in 1998, and then completed a postdoctoral fellowship in pediatric neuropsychology at the Hospital for Sick Kids. Dr. Mabbot is the head of neurosciences and mental health program and senior science within the Research Institute at Sick Kids, and a professor in the Department of Psychology at the University of Toronto. Situated at the intersection between clinical neuroscience, developmental neuropsychology, and regenerative medicine, Dr. Mabbot's research program seeks to A, understand how perturbed brain development manifests as cognitive impairment in children, particularly in survivors of pediatric brain tumors, and B, to discover how neuroplasticity in the developing brain can be harnessed for neural recovery and cognitive restoration in children with acquired brain injury. His work has been instrumental in documenting the thinking and learning problems children and adolescents treated for brain tumors experience and the underlying damage to brain structure and function that cause these problems. He is now conducting exciting new work to find ways to foster brain repair and cognitive recovery following acquired brain injury in children, including harnessing neuroplasticity from physical exercise and employing drugs that stimulate growth of new brain cells. Thank you both so much for being here. I'm so excited to see this presentation.
Thanks, Jennifer, for that introduction, and I'm so pleased to be speaking at the community forum today. It's always a great opportunity for me to have a chance to connect with the parents and families and important stakeholders in the work that we do. This type of research, it's critical to have a connection, direct connection with the main important people, which are parents, children, and their families. And so it's really great to be here. In this talk today, Darcy and I are going to tell you about an exciting clinical trial that we are working on together, looking at metformin and its role for treating cerebral palsy and the injury that's associated with cerebral palsy. And we're going to divide it into two sections. In my first section, I'm going to give you a bit of background in kind of the basic science and some of the early pilot work that I've done using metformin to show the feasibility and show the promise this drug has brain repair. And then in the second half, Darcy, Dr. Fehlings, is going to tell you about this exciting clinical trial that we are working on together and give you some background about it. It's ongoing right now, and so it'll be very useful for the information that she's going to share just about who the population is and the logistics of the trial. And so to my first slide then, really what we're talking on a big conceptual level is harnessing the brain stem cells. And so what I'm showing you here is a human brain on the left side and a mouse brain on the right side. And the human body starts off with these stem cells that I'm sure many of you are aware of. Stem cells are those immature cells from which all the rest of the body's cells grow. So there's stem cells for skin, from which our skin grows. That's probably the most commonly one. So if you ever have a cut and it scabs over, you'll notice that your skin grows back. That is those are stem cells. There's cardiac stem cells, and there's stem cells in the brain. And these um, only early on can they turn into any cell in the body. Later, later meaning in most children, once it's a brain stem cell, it can only become a brain stem cell. Once it's a cardiac stem cell, it can only become a cardiac stem cell. But what we're trying to do is, can we harness these stem cells that live in our bodies for brain repair? In the brain, in the human brain, in the mouse, there are a few places where these stem cells live. One place is known as the subventricular zone. And so what I'm showing you here is like essentially a cross section of the human brain. So the nose would be coming out of the screen towards you, and then the back of the brain would be at the back of the screen. And along the line with the ventricles, which are holes in your brain, essentially fluid-filled cavities in your brain, is this area called the subventricular zone. Here we see the subventricular zone in a mouse brain, and stem cells live there, and they can grow and differentiate into mature brain cells, and as they do, they actually migrate to the olfactory bulbs in the mouse brain, which is near the nose, and they're important for smelling in mice, and that's actually related to many important processes in mice. But they still live in humans as well. In humans, they're also in two other areas. In the white matter, so this area of white here in my slide, this is the insulation of the brain. There's stem cells that live there. And then if you look down here at this cross to this little structure here, which is called the hippocampus, and then I've blown it up here. This is the hippocampus here. There's a part of the dentate gyrus. The hippocampus is the memory center of the brain. And now if we go to the mouse hippocampus, so now this is a slice sagittally or laterally. So now the ears are coming out of the screen or into the screen. You can see the dentate gyrus, and here are stem cells here, and they grow and differentiate into neurons, into thinking cells in the brain. And this is a natural process that occurs with development, and it occurs even in adult brains for that matter, and it's important formation. And so the thinking is, can we actually harness this natural process to help the brain recover after it's been injured? And this is really work that was pioneered by my friend and colleague, Frida Miller. Here's Frida here. And thinking goes like this. So I'll show you this little schema here. So here's the human brain again. And so we give a person metformin, and it acts on a stem cell, the brain stem cell. We call that a neural precursor cell. And it probably now causes these cells to divide and grow into many cells and expand. And then they migrate, they move to the place in the brain that they should be, and they differentiate, they turn into specific kinds of brain cells. Neurons, these are the thinking cells of the brain, the gray matter. And then astrocytes, these are the white matter. These are the support cells of the brain. These are the cells that insulate the brain and make the brain work efficiently. The thinking is, if we can get metformin to do this, to grow these baby stem cells into new healthy cells, this could actually help the brain repair after it's been injured. Frida did some early work looking at how this actually works, and she was able to figure out this pathway called the atypical PKC-CBP pathway, which I'm not going to describe to you because I can actually hardly say it myself, but she knows it's like when a car is worked on by your mechanic, they look under the hood and they know the mechanisms of how it works. That's what Frida did. And briefly, what she did is she took a genetically modified mouse, that's this guy here, so he's been modified so that certain types of cells light up when they are exposed to a certain medication. This is not metformin, But it allows us to see certain types of cells in the brain. So this is the hippocampus here of the mouse. So this is this section here that I showed you already. So here's the hippocampus and the dentate gyrus, and you see in the hippocampus of a control mouse, or a mouse not treated with metformin, you have all of these green cells lighting up. These green cells are the stem cells in the mouse's brain. Now look at, sorry, I'm hearing someone else. I apologize. If you look at the mouse treated with metformin, now you see all of these new precursor cells in green. There's many more new stem cells. These are the actual neurons that these cells turn into. So here's the mouse who wasn't treated with the metformin, and here's the mice who were treated with metformin. You can just see by looking at these pictures, there's many more new neurons. And Frida actually went on to show that the neurons actually, these new neurons are associated with improved memory in these mice. And so this was a very exciting finding that really stimulated all of this. Actually, this work by Frida was supported by frida, a funding agency that many of you know, and led to much of the rest of the work that we're doing. I'm going to take a quick detour to tell you about some of the brain tumor work that we're doing, because this has really set the stage for the CP trial that Dr. Fehlings is going to tell you about. When we learned about the effects of metformin, we decided to see if we could use this as a drug to help treat the brain injury and the cognitive damage that children who survive a brain tumor experience because of their treatment. So we're really looking at whether metformin can repair the brain and foster cognitive recovery. And we looked again at both a mouse model and also a pilot study of radiation injury. So we had a mouse model of cranial radiation, and then we conducted a pilot placebo-controlled double-blind crossover trial, big mouthful there, of metformin for brain repair in children treated with craniospinal radiation. And why we looked at these children is because they have multiple injuries that essentially they sustain in our process of curing them from the brain tumor. There's the tumor itself. Surgery, so there's the tumor right there, can have an impact and injure the brain. They're treated with radiation that cure, but can also lead to an injury in the brain, and chemotherapy. And this is work that we published recently in Nature Medicine. What we want to do with this kind of work is it's very early on to find out, are we aiming at the right place? So I'm sure with COVID right now, everybody is aware of the vaccine trials. Probably everybody knows more than they want to know about clinical trials these days. There's phase 1 trials, there's phase 2 trials, and phase 3 trials. And in the early phase 1 and 2 trials, we're really trying to make sure we're looking in the right place, is safe. We ultimately want to get to a phase 3 trial, which is where I think 3 or 4 of the vaccine trials for COVID are now. But if you remember, when anybody talks about the early trials, they say that we can't get too excited about this as yet because it's not the definitive phase 3 trial. We have to wait till the end. And so I just want to highlight, this is not the definitive phase 3 trial that I'm telling you about for metformin. It's an early trial to see, are we looking at the right place and is things safe? And the first thing we do to see if we're looking at the right drug in the right place is we do a mouse model. And this is work that Cindy did. So she now took that same genetically modified mouse, cells to light up, and we can see them, and she treated it with radiation. And this is kind of the experimental paradigm here. So P17 stands for postnatal day 17. So this is a mouse that's 17 days old, 18 days old, 42 days old, and 50 days old. This is roughly equivalent to childhood and early adolescence in mice. So these mice were radiated with radiation, and then took the stem cells from their brains and grew them in a petri dish. That's this neurosphere assay. And then further, other mice she treated with metformin, and then they were tested with mouse cognitive tests. And then she also now looked at the same um, in another assay. She grew them in a petri dish and stained them to see which ones would light up to show. So all I want you to do is look at the number of little dots that light up. These little dots are stem cells. They've been stained. And so here are the control mice who haven't been treated with any metformin or any radiation. Here are the mice that were treated with radiation. You can see some far fewer stem cells. So that's something to keep in mind. Radiation damages the stem cells. But now look at the mice who were treated with radiation, got metformin. There's many, many more stem cells. And you can see that in this background as well. So they are, their stem cells are regrowing because of the effects of metformin. She also did mouse psychological testing and looked at their memory using a test called the Y maze. So this is a test of mouse working memory where a treat is put on either arm of the maze, and the mouse goes and finds it. And then that treat is removed, and they see if the mouse can remember where the treat was. And if you look here, so this is the percent correct. These are the control mice that were not treated with any radiation or metformin. You see they're, roughly about 60% correct. Now, if they are treated with radiation, they decrease their, they get worse. And this is a significant difference. But if you give them metformin, their performance goes back up to the same level as the healthy mice kids. And so we've rescued or we've recovered working memory in mice treated with radiation. Now you'll notice I have a plot for female and male mice here. That's because we only saw this effect of metformin in female mice, which I think is something we want to keep in mind when we do our pilot trials. The second thing we did as part of this study was actually a pilot clinical trial of metformin in children treated with radiation. So I should have told you before, but I'll tell you now, metformin is a well-known and used drug for diabetes. We've been using it since about 1959, and it's been used in children as young as 2 years old. And it's been used fairly extensively, so we do know its safety profile. And so we were fairly confident in using it in humans. But we still wanted to make sure it was safe and feasible, and that was why we did this pilot trial. There's been other work that has shown that it actually helps improve memory in older adults. And so we thought this is a really good drug to look at for helping to improve cognitive abilities in children who've had a brain injury. Our main goal is to use this trial to develop a large phase 3 trial. That's the goal. Because of that, our goal is safety first. We want to make sure this is safe to do, and we want to target the right areas of thinking ability or of the areas of the brain, so we make sure we are looking where we need to look. And this was work that a student of mine, Rami Ayoub, and also my friend and colleague, Dr. Eric Buffet, who's the head of the brain tumor program at Sick Kids. I'm not going to spend a lot of time on this slide, but just to show you that this is kind of how our trial schema looks. We started looking at 130 patients, but ultimately, when we excluded those who weren't eligible or didn't participate, we ultimately had 24 patients who we randomized to 2 different arms in a crossover trial. Crossover trial is a challenging trial to run. I'm not going to go into the details for you because I don't ever want to do a crossover trial again in my life. But I wanted just to highlight what we looked at. We looked at safety and feasibility. We looked at blood work to see if metformin, what it's doing in terms of the basic metabolics of the child. Were there adverse events? Were there events that were associated with the drug treatment that were negative for the kids? We looked at medication adherence, how well children and family were able to take the drug, and procedural adherence. Did they come to all the appointments? We looked at a number of different measures of memory and attention and processing speed, which I'm going to tell you about. And we also looked at brain imaging measures of the hippocampus that I told you about earlier, and of the white matter. I'm not going to talk about these outcomes today just because we don't have tons of time. But first things first, we found that metformin was safe and feasible to use in survivors of pediatric brain tumor. So here are a list of adverse events. And you'll see the most frequent events are things like vomiting, diarrhea, nausea, stomach pain. These are the typical adverse events. Adverse are associated with metformin from the past literature. And you'll see the kids treated with metformin, so each one of these yellow and red and blue colored blocks is a child. There were more adverse events in the kids treated with placebo with metformin compared to those treated with placebo, although there were still adverse events in these kids as well, compared to many other events. But these adverse reactions the kids had were not severe enough that they said, I don't want to do this anymore. They continued on with the trial. And so we were able to say this is and there were no serious adverse events that would say this is dangerous for the child. And so we could say it's a safe and feasible to use metformin. And we actually saw that there is a possibility that metformin may increase memory. So here's the baseline before kids were treated. The blue line is kids treated with metformin. The orange line is kids treated with the placebo. And see, there's increases in memory, increases in the number of words kids could remember on this task. And on another task of working memory, increases in their accuracy treated with metformin compared to placebo. We did another set of how quickly kids could complete tasks. So now these are all times. And so now they got faster. You want the line to go down. Kids treated with metformin got after metformin treatment. Now I will highlight, these are small numbers of kids. This is a pilot trial, which is something we always have to keep in mind in early trials. This is not the phase 3 trial. So we don't know for sure, but this is promising, and this is where we should be looking for phase 3 trial. So really what this told us is we can go ahead with a phase 3 trial. Metformin is tolerable in brain tumor patients with no adverse effects. I hope you noticed the synergy of findings between our mouse and our human studies. Both the mice treated with metformin and our kids showed improved memory, which really is exciting for us. We don't want to get ahead of ourselves, but it's exciting and tells us we need to look further. And we don't want to get ahead of ourselves because this is a very small pilot trial. Same reason why when we heard from Moderna about their vaccine in a pilot trial, in a phase 2 trial, that there was some effects, it was only in 20 people. So we don't get excited until we see the final vaccine trial with 30,000 people. We haven't done that large trial yet. We have funding for it now, and we're currently doing it. But community forum is a forum about cerebral palsy, and so many of you might be saying, you know, this guy's talking about brain tumors. That sets the stage to talk about the same work now that we're doing in children with cerebral palsy, and this is the work that Dr. Fehlings is going to tell you about. And like the radiation story, we also have the preclinical data from animal studies to show that this is where we should be looking. So this is again work by my colleague Cindy Mooreshead, and she has shown that metformin stimulates brain repair in a hypoxia ischemia mouse model of childhood brain injury, which is essentially a mouse model of cerebral palsy. What she did is, so again, P0 is day zero birth, prenatal, and then postnatal day 8, these mice were given a hypoxic ischemic injury, and then day 9, they were treated with metformin and then had a number of behavioral tests all the way till day 23. One of the tests is a cylinder test where the mouse is put in a cylinder and they need to explore, you know, that's their natural reaction is to explore the cylinder. But the mice with the hypoxia ischemia model have a hemiplegia. So you can see that in this bar graph, how often they use a single paw instead of both paws is shown in these bars. And this yellow bar is those mice with hypoxia ischemia. They are only exploring with one arm, with one paw because of the hemiplegia from the injury. But if the mice are given metformin, this is the blue, they are performing this task the same as those mice treated with have no injury or have no injury and treated with metformin. So they've recovered their motor function, which I think is a key story when we start thinking about cerebral palsy. Now, here's a bar graph that shows you in a bar figure those the data that's similar to the colored slides earlier on, where there's many more new stem cells in the corpus callosum, which is a big portion of white matter, in the mice treated with metformin compared to those not treated with metformin. So this work of Cindy's was really the inspiration for doing a pilot feasibility trial of metformin in children with cerebral palsy. I need to thank my lab and my funders who helped fund this work. And again, a shout out to 3B who really helped fund the early work that Frida and Cindy did. And with that, I'm going to pass you over to Dr. Fehlings, who's going to tell you about the clinical trial, the feasibility doing together.
Thank you so much, Dr. Mabbot. That was a really great segue into this exciting study that we are embarking on in children with cerebral palsy. So I am going to talk a little bit more in a focused way about the study. So this is a randomized controlled trial, and as Dr. Mabbot was saying, it's a still an early phase 1, phase 2 study. So it's not a big phase 3 study. We're trying to show safety, and we're trying to see if there's a signal in children with cerebral palsy. But we're starting with a very strong study design, a blinded randomized trial. And we're hoping to recruit 50 children into the study. And half of the children will receive metformin and physiotherapy, and half of them will just receive physiotherapy alone and take a placebo pill. And one of the main outcomes that we're looking for is there an improvement in movement skills? We're also looking at, is there an improvement in cognition? Dr. Mabbot highlighted some of the early encouraging work in children with brain tumors, and also the findings in the rodent models around cognition. And we're also looking to see if it's feasible. One of the questions you might be thinking about is, well, hasn't Dr. Mabbot already shown that it's safe and feasible in children with brain tumors? But we also feel it's very important to look at the safety features in children with cerebral palsy, because there are different health issues in children with cerebral palsy. There we go. So our primary aim is the study feasible. This is where we answer questions like, can the study be run the way we've designed it, or do we need to change things for the big study? We really are interested in if we can detect a signal in what metformin can improve. We're specifically going to be looking at movement and motor function in children with cerebral palsy, but as mentioned, we're also going to be doing detailed testing on cognitive abilities. We're doing detailed imaging to see if we can pick up a signal in the structure of the brain. As many of you are aware, we're able to do really detailed evaluations with our neuroimaging and MRI. And so we're going to see if there's a signal there. And then we're also looking at quality of life, caregiver impact, and cost of metformin, and the health economic impact. So I had 5 slides that listed all of our inclusion and exclusion criteria, and I thought that might bore you. So I've simplified it into this one slide, but we do have lots of aspects that we're looking at to ensure that the children that we're bringing into the study will be able to participate in the study. Our study is focused on children 5 to 13 years old. We have focused on children born prematurely. And the reason for that is Dr. Mabbot highlighted in Dr. Cindy Morrishead's work that where we were seeing a lot of the change was in a white matter area of the brain. And in children who are born prematurely, they often have a predominant white matter injury. And so we're trying to maximize our opportunity to actually pick up a signal change with the metformin. We want the children to be medically stable, diagnosed with spastic cerebral palsy. They can have elements of mixed tone, but they do have to have some underlying spasticity. We're focusing on children who are GMFCS level 2 to 5. And the reason we're not aiming to recruit children who are functioning at GMFCS level 1 is that we want to try to maximize their opportunity of seeing motor change. And children who are at level 1 are already functioning at a very high level. So how are we measuring these things? Recruitment, we're looking at safety, similar to how Dr. Mabbot presented the information. We're collecting lots of information on how the child feels when they're in the study. In terms of our outcomes, we're going to be using the GMFM 66 as our main motor outcome. The MTS stands for a measure of spasticity. It stands for the Tardieu scale. And we're also setting individualized goals with the children and families so that we can see if there's improvement on the individualized goals. We're doing really detailed cognitive testing. And then these are our quality of life and health economic measures. In terms of the study timeline, it is a commitment. So from start to finish, if you are a participant in the study, you're involved with us for 10 months. We have the metformin placebo period lasting 4 months or 16 weeks. And with that, we have lots of safety checks. And the child is also receiving individual twice weekly physiotherapy. And there's a home program that the child also does with their family. Just in terms of the physiotherapy sessions, we have a team of trained physiotherapists. We are running a study for the physiotherapy sessions out of Holland Bloorview, and it's 45 minutes a session. The therapist works with the child to develop an individualized program, but it's very much based on motor learning principles and active participation in therapy. I thought I might just talk a little bit about the potential side effects of metformin. Dr. Mabbot highlighted some of those, but the main ones that we see clinically are gastrointestinal side effects. So sometimes you can get some change in your bowel movements, some nausea, some vomiting, some tummy pain, indigestion. Those are the ones that can be seen. And within the study, we do have the opportunity to modify the dosing if a child is experiencing side effects. Some of the less frequent side effects, but that we will still be monitoring for, are listed here. So some weakness, headache, muscle pain, lightheadedness, shortness of breath. But from information on some of the childhood studies that are present, metformin seems to be well tolerated in children and also well tolerated in adults. In terms of the study status, we have Health Canada approval, and that's an important step. And it always takes a long time to get a study through REB, but we have our approval through Holland Bloorview and Sick Kids. And as I mentioned, we're aiming for 50 children, but we just have 1 child recruited to date. We have a long list of inclusion and exclusion criteria, and we've screened over 30 children. and we're hoping to enroll 2 next week. So we're on a roll, and we're hoping to build. I just wanted to finish my part of the talk by acknowledging our stakeholder engagement committee. So this particular study is funded through a network called ChildBright. And this is a network that focuses on what we call patient-oriented research. And we have a really active stakeholder engagement committee. Dr. Mabbot also highlighted the importance of stakeholders being involved very early on in the metformin story. So frida helped to fund some of the original research that Dr. Frida Miller did. And we're really a strong voice at the ChildBright Network table to say that to families, this was an important study to be done. We've continued with an engagement committee, and I've just listed the people on our committee here. I'm going to go to the next slide, but you'll notice that Brenda, who is attending today, is part of our stakeholder group. And these are the other 2 individuals that are on the study, on the stakeholder engagement group. We're following a structure for stakeholder engagement that the Ontario Brain Institute has proposed. And I really like this. It's a single-page graphic, and it just talks about all the important areas that stakeholders can engage in as a study is done. And you know, right now we're at this stage, but as we move to analyzing the results and disseminating the results, our stakeholder panel will help to engage in those aspects of the research. So without further ado, I'm going to stop sharing my screen, and thank you very much for your attention. And I will turn us back to Jennifer to facilitate some discussion. Thank you.
Thank you both. I'm gonna share my screen real quick, and I have some questions that have come up in the chat box. But I'll say what I think all of us were thinking was just wow, amazing work, amazing potential, and can we all take it? I kind of feel like we all should be taking metformin. It seems like a pretty amazing drug. So we have a couple questions here. You mentioned that if the side effects are too severe, can the dosage be decreased? Are you guys gradually introducing the medication?
Yeah, that's a great question. And we have, first of all, we have very little information to gauge how much metformin we should be using. But we're fortunate in that we had Dr. Mabbot's study to build from, and also another trial of metformin in children with autism spectrum disorder. And so we were able to gauge the dosing from that. And then we wanted to make sure that our study was flexible enough that if the child was having some side effects, you know, say their tummy was hurting, that we could decrease the amount and still be within our study protocol. There's lots of advantages to being in a research protocol, but there are very, very strict rules. And so we built that right into the protocol. Both Dr. Mabbot and I were trying to think very practically because we want to make sure that the children are successful. The other thing that we also did was very slowly build up the dosage so that there's that time for the body to get used to it. So we've tried to build both of those things to be as flexible as possible to make it easier for children to get to the 16 weeks.
Following up on that, how long does it take for you to start seeing metformin actually have an effect with the child?
Well, that's a great question because we actually, part of the study is to actually see if we can get a signal. We really don't know the answer to that question at this point in time. In terms of the timeline of our study, I think one of the really important aspects is we're looking for signal by looking for a change before, and then at the 16-week mark, but we also want to see if any of those changes are maintained over the next 6 months to give us information on a longer term impact of the metformin. And so that's why we also have a 6-month follow-up at 10 months.
Got it.
Yeah, and
I'll
but I don't
just
know if you
add
wanted to
that
comment.
I'll just add in the trial that we did in the children with brain tumors, that was 12 weeks of metformin. So we started to see what we thought, were promising signal after 12 weeks. But it really is an open question
Yeah.
about how long, should treatment occur, and both how short, how soon can you see it, but also is this something that should be done more longer term? And I think that's also where some of the animal models will come in to help guide us, because if we're going to, the side effects are not serious, but there still are side effects. So we don't necessarily want to say, okay, a child's going to be on metformin for the next 30 weeks necessarily. There has to be that real important trade-off. But certainly the phase 3 trial that we're doing now, that we've been funded for, which is a efficacy trial, we're using the 6-week window that we decided upon for the CP trial. So that was informed by the first trial, and then we started the CP trial, and now we're doing our next brain tumor trial based on the CP trial of 16 weeks. So, and that also, I think, is informed by how long it took in the animals, but it really is an open question.
I have a question from Wendy Sullivan. I'm sorry, Darcy, did you have something to add? Okay, so her daughter has been taking metformin for 6 years for insulin resistance, and her daughter has cerebral palsy. And she said, I noticed that you're having a 4-month duration of the study. Do you anticipate long-term use? I think,
Yeah, again, we've touched on that a little bit in our answer already. This will be the first study in children with cerebral palsy, and so we are really looking for information on safety, and we're really going to be looking for what I call signal. So are we seeing a signal in motor change? Are we seeing a signal in cognitive change in children with cerebral palsy? And if we get that good safety information and some evidence of signal, then that allows us to move forward with a bigger, larger study and to start answering some of these other really important questions like dosing, how long. We just don't have the answers yet. We're very early in our evaluation of metformin for cerebral palsy. It certainly looks very encouraging, but we also don't want to overpromise in this study either. It's a small study still, and we know every individual child with cerebral palsy is very different, and so we really need to take it step by step. And I know sometimes that can frustrate families in particular because we want to drive things forward quickly. But I can say with lots of confidence that we are being very thoughtful about this particular study, and we will get information out as long as we're successful at recruiting. So that's really where we're focusing now, is making sure we achieve that 50 children mark for this study.
I think that's what we appreciate so much about you and what you're doing, is that you are so thoughtful about all of this, and that it's not willy-nilly, and when the information, when you're ready to do the larger study, it'll be done right, and that's what we appreciate so much.
And I think we're living in a time where the whole world kind of is experiencing the same anxiety and frustration that many of our families who we worked with, wanting a treatment and wanting it now, but knowing to do it right, to do it safely, and to make sure that it is actually working takes time.
Yeah.
And that's that's our real basis, to make sure that we are doing this the right way.
Absolutely. We had a question, and I actually thought of this as well. How long, and maybe you're not there yet, but how long post brain injury can you do this? Can you take metformin? Are y'all there yet? Do you have an idea?
I think we know from the animal studies that there's no a limit necessarily in terms of how long post. So in the brain tumor study that I did, many of the children were 5, 6, 7 years post injury, and if you think about how it works, the stem cells are there in the brain, and even after the injury, they are still there, and so we're just trying to turn them on. So it shouldn't necessarily limit the time from the injury. Shouldn't necessarily limit when we can actually give the drug. I don't know if Darcy, Dr. Fehlings, if you have other thoughts, but
I just was going to add that it's a really important question to think about, because when we're working with children with cerebral palsy, often they've had an injury at a much earlier time. And so we really are looking at a more chronic injury. And then the only other comment I would make in terms of a research study is you wouldn't want to start the metformin too soon, because you want to make sure that other aspects of the child's health were stable. One of the more serious complications for metformin is something called lactic acidosis, and it can happen more frequently if the body is under stress for other reasons. So you want the person to be in a sort of a stable health state before you start metformin in a research study.
Got it. This is a great question. How on earth did you guys come from a diabetes drug treating diabetes to it's treating a brain injury? Where did that idea come from? I love this question.
It's a good question. Don, do you want to talk about how Frida
sure.
started?
So that really is a question for Frida Miller. And it was serendipity is what Frida, I'll channel my inner Frida because I know her well. And what she would say is it was serendipity. She was talking with a colleague down in the States who looks at metformin and treating for diabetes and the kidneys. And there was a pathway, that pathway that I mentioned, the PCBP pathway that's both in the kidneys, but it's also in the brain. And so Frida went, well, maybe this will work in the brain. And then actually Frida and I were talking at a conference together. She was talking about her metformin animal work. I was talking about some other work that I do with physical exercise and using exercise for neuroplasticity. And we both kind of looked at each other and said, we're kind of really talking about the same thing, and that is harnessing the actual power that's in the brain already for repair. But it really is serendipity. It's just kind of one of those, often science is like that. It just kind of, it happens by chance, and you look back and you say, how do we do this? It's great. But
Wow.
And I think you know, with that as an introduction, I think she then went into like cellular culture models and was able to test many different drugs to see, and saw a signal with metformin, and that stimulated her to continue to investigate.
Super cool. Are you guys recruiting from the area near the hospital, or are you recruiting further abroad? Are you recruiting in the US for families who are here willing to travel up to Canada?
So right now it is geographically located. We need to have the children live close enough to Holland Bloorview, which is in the middle of Toronto, to be able to attend the physiotherapy twice weekly. So
those families willing to move up there for a little bit, is that a possibility?
You know what? I'm going to have to defer answering that. I'll look to see what our REB has said. Something that's against our REB. But
you have to quarantine for 2 weeks anyway.
Right. I was kind of curious about the cognitive testing with comparing the children who have had brain tumors versus children who have had cerebral palsy. So a child who had a brain tumor, I'm making the assumption that prior to the brain tumor, they were functioning normally. They have a brain tumor, they end up with an injury, and now they aren't. So they had capabilities, and then now they don't. Versus a child with cerebral palsy, who didn't already have the capabilities. So when you're testing it with the kids with cerebral palsy, how are you able to see in the cognitive testing whether they are improving? Versus, I feel like with the brain tumors, I can understand, I can get my head around that a little bit easier
Yeah,
than
no,
CP.
it's a great question. And I'll just speaks to why we need to look at different populations of kids, because the kind of injury from a brain tumor is a cerebral palsy is often more like a developmental injury. It happens very early on in development, and it affects much of a child's early development. I think the big reason why we can look at changes in cognition is because in this feasibility trial, we are doing it as a placebo-controlled trial. So one group of kids is getting physiotherapy and a placebo, right? And we look at what happens in terms of their thinking and learning skills. We compare them to another group who now is getting physiotherapy and metformin. So it's because we can compare the two groups. And what we're seeing is there more change in the kids treated with metformin than the kids treated with placebo? And that's how we'll have a sense as to whether it's having an impact on some of these cognitive abilities that we're looking at.
Got it. That's very helpful. I'm looking to see, I think we're rounding out the questions here. I am just blown away by this topic, and I'm so appreciative of the time and everything you guys have put into this, and I'm so hopeful. This presentation leaves me with a lot of hope, and I think that you guys are probably going to be getting a lot of calls from families who are also very hopeful, and hopefully you'll be able to recruit these 50 kids or 48 kids at this point. And I'm really excited to see where this goes and to learn more as the years go on.
We're very appreciative of you inviting us to speak at the community forum. And as we mentioned as part of our talk, we wouldn't have received the funding for this study if it hadn't been for a really powerful stakeholder voice. So we're very appreciative of that. And so we thank you.
Thank you. Y'all have a wonderful day.
Thanks. Take care.